Don't be fooled. Having a Medicare Advantage plan by itself is leaving you vulnerable to medical cost you may not be aware of. What's up, friends? Rob here, the Medicare Minister with Agape in North Mississippi. And today I'm going to be talking about a must-have plan that you need to have to go along with your Medicare Advantage plan. And if you're watching this video today, chances are you probably already thinking about signing up or enrolling in a Medicare Advantage plan, or you are currently on a Medicare Advantage plan. Well, then you definitely want to watch this entire video, because we're going to be talking about a special gap plan that you can put in place to shield yourself against medical costs you may not be aware of. Now, chances are you've seen these commercials on TV with these celebrities, these online ads, or maybe billboards, or maybe you're even getting tons of phone calls from call centers across the country that are telling you about these zero premium plans. They don't cost you anything, and they include all of these extra benefits like dental, like vision, hearing, over-the-counter cards, gym memberships, and more. And while that is true in many cases with these plans, you do need to be aware of cost that these ads or these billboards, or a lot of times these call centers, won't tell you. And that is the goal of this video today, is to talk about those costs briefly and how you can shield yourself against those costs. This is what's known as a Medicare Advantage plan or a Part C plan. Real quickly, what is a Medicare Advantage plan? These are simply private insurance companies that have been approved by Medicare, and they're under contract with Medicare. You could kind of say it this way: Medicare is the general contractor, and they're subbing all of your healthcare benefits out to these private insurance companies. Just to name a few, like Aetna, United Healthcare, Humana, Blue Cross Blue Shield, and more. It really just depends in which area that you live in. And what they do is they take all of your Medicare benefits plus ancillary benefits, and they put it all under one roof, if you will. Why these can be decent plans or good plans for you, because a lot of times there's many Medicare beneficiaries that can't afford to go the traditional supplement route, where they have to pay for a Medicare supplement, a drug plan, and any other plan that they may need to help them address their healthcare needs. So while there's many that can't afford that, these plans can be a great alternative or a good alternative for them. But there's just some things that we need to be aware of. So let's talk about these copays, these costs that you are vulnerable to if you just sign up for a Medicare Advantage plan by itself. Number one is daily hospital copays. In my area here in North Mississippi, they are around $295 per day, and some plans only have it in the fine print where you're responsible as the Medicare beneficiary for days 1 through 7, while there are other plans that have you responsible for that $295 days 1 through 9. So this can get very costly if you do not have something in place to shield you against that. Number two is outpatient surgery copays. Once again, I'm just using examples from my local area here in North Mississippi. Those copays range from $225 to $295. So every time that I have an outpatient procedure done, while I don't have to pay the full price, I will have to pay that little small copay. Once again, if I have a reimbursement gap plan in place, I can shield myself against that. Now, before I go to and give you the other three copays that you're responsible for on a Medicare Advantage plan, if you are getting value out of this video so far, please take a moment to hit the like button for us. This just helps us get found by more Medicare beneficiaries like yourself. All right, so we've talked about daily inpatient copays. We've talked about outpatient surgery copays. Now let's talk about ER visit copays. In my area, those range around $120. So once again, if I have something in place, one of these properly structured gap plans in place, I can shield myself against those costs. Ambulance copays, $290 to $295. And then skilled nursing, which is very prevalent when it comes to, or very popular, I should say, when it comes to Medicare beneficiaries, because if you fail and hurt yourself, if you hit your head, or if you just had to go for some reason, had to go into skilled nursing, whether in a facility or you just had to go to a facility, you definitely want to make sure that you have something to shield you against that, because days 1 through 20 are covered. But if you've had something serious happen that's going to require you to stay past that 20 days, then you're responsible for around $203 per day, where you could put a little gap plan in place to shield you against that. So that's 1, 2, 3, 4, 5 copays that these commercials, these ads will tell you about that are leaving you vulnerable if you do not have something to protect you. This is why it's important to get what's known as a hospital indemnity plan, or what I call a gap plan. Some people call it a reimbursement plan. Whatever you want to call it, the bottom line is it needs to be properly structured to come alongside your Medicare Advantage / Part C plan to shield you against those costs that you are exposed to. So this is why I believe you need to work with a seasoned Medicare agent like ourselves here at Agape, and you can call the number on the screen there. And we work in most states, but if we don't work in your state, we will connect you with a seasoned Medicare advisor that we know and trust to make sure you get this put in place. So whether you are thinking about enrolling, maybe you're new to Medicare, you're about to sign up for one, or a Medicare Advantage plan that is, or you're currently on a plan, you can definitely get one of these plans for you to help shield you against those costs. I want to be very clear. It's not required for you to get this plan, but I am so passionate and believe that they are necessary. Now, one side note that I need to make you aware of, underwriting is required. So some of these companies have what's known as a guaranteed issued program or guaranteed issued period, which just means I can be guaranteed the plan if I'm within a certain age. But if those companies don't offer that for your particular age, then you will have to go through underwriting, and that's usually pretty simple. You have to answer, some underwriting, some health questions. And I would say most of our people do get approved for the gap plan. Once again, if you don't have somebody to help advise you with this, call the number on the screen or reach out to us, the website link in the video description below, and either myself or one of our advisors would be more than happy to help you make sure you get one of these in place. As I finish today's video, I want to make you aware of a few tips that you need to be aware of when it comes to enrolling in a Medicare Advantage plan. Do your best to get on a PPO plan. While an HMO plan is going to give you some more benefits, they're going to be more benefit rich, if you will. They are going to be very restrictive when it comes to the providers that you use, where a PPO may have less benefits, but it's going to give you the flexibility you need to go in and out of network just in case you get referred to a provider out of the network. Number 2 is I believe you shouldn't work with a captive agent. It's not that captive agents are bad, but captive agents only represent one company. You want to work with broker advisors like us here at Agape, where we work pretty much with all the companies. And so that way you're truly getting an unbiased approach to what Medicare Advantage / Part C plan is going to be the best for you and your needs. And then finally is you make sure that whoever you work with, that you get all of your meds to them and you have them checked against the plan's formulary, because they're in some cases, your medicine may not be covered in that particular plan's formulary. And if not, then you could be responsible for the full price of that medication. So checking your medicines or medications is very, very important. And then finally is you also want to make sure that they check all of your providers. You want to check your doctors, your specialists, your nurse practitioners, your durable medical equipment company that you're using maybe for a nebulizer or a CPAP or some other type of DME or durable medical equipment device. You definitely want to make sure that all of your providers and hospitals are in that plan's network, because if not, especially if you're not on a PPO, it could really leave you exposed to where you have to pay full price for those services rendered. Well, I pray that you got some value out of this video today. God bless you guys, and we'll see you on the next video.